What do you mean by Mandagni? What is the interpretation of Mandagni as per Ayurveda terminologies? This is the topic of discussion in this particular video. Dear community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. From this particular video, we are going to start some of the Shloka interpretation series. When you think about the interpretation as such, one of the very important Shloka, which is considered to be one of the essential component or factor that has to be known to understand the principles of Roga Nidana, that is Roga Sarvepi Mandeyagna. This is being mentioned in the context of Udara in case of Madhava Nidana, plus this is the description available even in Ashtanga Hridaya Nidana Sthana in the context of Udara. So that is being mentioned. Rogaha Sarvepi Mandeyagna. All the diseases which are considered to be manifested in the body, they are considered to be due to Mandagni. So it is being mentioned that the Agnimandyam cha doshatraya janakam. So here there are two aspects, Mandagni and Agnimandya. When you think about this, Mandagni is considered to be the Kapha Pradhanya Janya functioning of Agni, whereas Agnimandya refers to the poor functioning of Agni. Actually, they are not actually similar. Wherein Mandagni is specifically seen in case of Kapha Prakriti individuals, whereas Agnimandya can be observed in any of the Prakriti individuals. Vata Prakriti person may have Agnimandya, Pitta Prakriti person may have Agnimandya, and Kapha Prakriti person may also have Agnimandya. So, regarding the interpretation of this, what is the meaning of Agnimandya? So, there may be a possibility of Snigdha Guna increase in the body. There may be the possibility of Sthira Guna increase in the body. There may be the possibility of Guru Guna increase in the body. There may be the possibility of Shita Guna increase in the body. Manda Guna and Shlakshana Guna. All they are having the qualities of Kapha Dosha there. We are going to expect the increase of Kapha Gunas in the body. What we can say, that could be Agnimandya. When you think about the Agnimandya, so what, where and all we are going to observe the extent of this. We are saying that Agni is being present in the Mahasrotas, Agni is present in the Dhatu level, Agni is present in the, what do you say, that the Bhutagni level also. When you think about it, extent of Agnimandya may be in the form of Jatharagnimandya, in the form of Dhatu and in the form of Bhutagnimandya also. When you think about the Jatharagnimandya, there will be the dysfunctioning of the Agni that may be observed in the Mahasrotas, maybe the stomach and small intestine, wherein the intravascular compartment, there may be the possibility of what do you say, that Agnimandya, wherein there may be the possibility of Rasagni as well as Raktagni dysfunction. Whereas the Mamsagni, Medo Dhatwagni, Asti Dhatwagni, Majja Dhatwagni, Shukra Dhatwagni, we are going to observe in the interstitial as well as intracellular compartment dysfunctioning. In the sense, so Jatharagnimandya as such, we are going to see in the alimentary canal, whereas Rasa and Ratta Dhatvagnimandya we are going to see in the intravascular compartment. Mamsa Dhatvagnimandya up to Shukra Dhatvagnimandya we are going to observe in the, what is the interstitial as well as intracellular compartment. Whereas the Bhutagnimandya, that may be observed in respective tissue levels. Inside the cell, there may be the possibility of the, what do you say, that the disturbed functioning of Agni that can be attributable to Bhutagni. Regarding the outcome of specifically Mandagni, Jatharagni Mandya. So in that particular situation, there may be the possibility of dilution of the hydrochloric acid. Because of the poor dilution, that is because of the poor functioning of hydrochloric acid, there will be the poor conversion of a pepsinogen into pepsin. Because of that, there may be the hampered conversion of the macromolecules into micromolecules. And along with the poor the these pathogens, etc., macromolecules, etc., there will be inflammatory markers will be produced. Because of that, there will be influx of the fluid that is going to take place from the capillaries of the stomach into the lumen of the stomach. And because of the stasis of macromolecules for longer amount of time, there may be the gastric mucosal damage. Because of that, these macromolecules which are being present in the stomach that will be entering into the intravascular compartment. As they are macromolecules, they are going to bypass the liver. They straight away enter into the heart via lymphatic system. Thus, we are going to observe the entry of these pathogens into the interstitial compartment and intracellular compartment in case of conducive environment. So, in the sense, the rogaha sarvepi mande agnau refers to the poor functioning happening because of the source of the entry of the pathogens that is going to take place through the oral cavity, which in turn leads to dysfunctioning of the Jatharagni. Thereby, there may be the possibility of dysfunction of the Rasa and Raktadhattvagni. Later, we are going to observe the dysfunctioning of the Mamsa to Shukra Dhatvagni, as well as we are going to see the dysfunctioning of Bhutagni. This is what we can say the Rogaha Sarvepi Mande Agno. So, wherein the Mandagni is something different, wherein we are going to see in the Kapha Prakriti individuals, whereas Agnimandya can be seen in any of the Prakriti individuals. Dear ANA community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose.